graded as a group. Okay? So, mamaya, magbubunutan tayo of who would be the first reporter for our topic. So, I believe our topic for today is asthma, chronic obstructive pulmonary disease or COPD, chronic bronchitis, cystic fibrosis or CF, and pneumonia. Okay? So, sino ang nag-send ng PowerPoint tong mga nabanggit ko?
Ako po,
Sinong
sir. Sa
kakagiya? So, okay, so hanapin ko dito. Kasi sabi ko sa inyo para fair, di ba? Sabay tayong mag-open. Baka sabihin nyo naman advance ang ano ko binasa eh.
Alis kayo?
Kaya lang, hindi nagana ang aking Y-mail. So, habang nag-aantay tayo, okay, saglit lang ha. Asa iba? Walang internet? Ba't hindi nagana yung Yahoo ko? Miss Kigia, you sent it sa ano ko, no? Sa Yahoo Mail ko, tama?
Opo, sir.
Oh my. Sige, wait lang ha. Hindi ko mabuksan eh. Ngayon nyo ha. Hello po. Ayun. So, hindi ko siya ma-open siguro because of the internet. Pero okay lang. So, ipapakita ko lang sa inyo yung mga letters para makita nyo na lahat ng group nandito. So, basically, you are 8. Tama? You have 8 groups. And each group is composed of 4 to 5 members. Tama? So H, hindi, simula ako sa A, which means group 1. B, group 2. C, group 3. D, group 4. E, group 5. F, group 6. G, group 7. And of course, H, group 8. Okay? So, ipo-fold ko siya individually para makita nyo na sila din yung mga bubunutin ko. Okay? Ayan, so there are 8 already. 1, okay. 1, 2, 3, 4, 5, 6, 7, and 8. Okay, so 8 sa lahat. Okay? So ang siste, okay, kung sino mabunot natin, okay, siya yung magre-report. Okay? But, okay, if in case, for example, your group is the one who prepared for the certain narrative or presentation for a particular topic, then kailangan natin bumunot ng iba. So basically, meron na akong listahan dito. Base to sa mga sinend ninyo, okay? So, I know that group 1, Kagiya, Cervivitis, and Yocte, kayo nag-prepare for asthma, COPD, chronic bronchitis, cystic fibrosis, pneumonia, tama? Group 2, Abesamis, thank you. Group 2, Abesamis, Guillen, Martinez, Molina, Perey, kayo nag-prepare for cryptogenic organizing pneumonia or COP, bronchiectasis, tuberculosis, TB, pulmonary embolism, and pneumothorax, tama? Group 3, thank you. Group 3, Cervera, Erdau, Hina, Reyes, Tabelisma. Kayo nag-prepare for lung cancer, anemia, hypertension, coronary artery disease or CAD, acute coronary syndrome or ACS, and cor pulmonale. Tama. Group 4, Evangelista, Laksamana, Pereya, Salazar. Kayo nag-prepare for urinary tract infection or UTI, benign prostatic hyperplasia, or hypertrophy, BPH, cystitis, diabetic ketoacidosis or DKA, chronic kidney disease or CKD. Group 5, Decano, Dauden, Nacario, Redondo, Tauboniuen. Kayo nag-prepare for cholecystitis, pelvic inflammatory disease, systemic lupus erythematosus or SLE, Graves' disease, Hashimoto disease. Group 6, Perez, Rina, Rodriguez, Tobillo. Kayo nag-prepare for multiple sclerosis, rheumatoid arthritis, myasthenia gravis, Guillain-Barré syndrome, inflammatory bowel disease. Group 7, kayo nag-prepare Almendra, Condorilla, Haka, Regala, Vergara. Kayo nag-prepare for lymphoma, leukemia, Kaposi sarcoma, breast cancer, and brain cancer. Group 8, Alinsonurin, Dalus, Marasigan, Parabuak, Samosa. Kayo nag-prepare for Crohn's disease, Ebola, swine flu, hepatitis, and acute flaccid paralysis. Tama ba ako? Okay, tama ako. Since walang violent reaction. So, okay? So, you are to present your topic, you are to present kung ano, yung group na mabubunot, you are to present kung ano yung topic natin. So, for this day, okay, hopefully, ma-meet natin ang topic natin, asthma, COPD, chronic bronchitis, and cystic fibrosis and pneumonia. Okay? So, yung reporting ninyo, okay, it would be a group grade din, but I will also sort to individual grading. Okay? Kasi syempre, kung meron mas magaling o mas maayos ang reporting niya, mas bibigyan natin siya naman din ng credit to that. Okay? Question. Sino pa kaya ang hindi pa nakakapag-send ng report? Honest to goodness. Sino pa? Meron pa bang hindi nakakapag-send ng report? Wala na. So everyone nakapag-send na ng kanilang report. Okay? Wait lang. Okay. Oh my God. So si Kagia ang nag-send, tama? Miss Kagia, excuse me.
Yes po, sir.
Nag-send kasi sa akin set 1 and set 2. Anong difference ng set 1 and set 2?
Hindi pa nagkamali lang po. Set 1 po pala yung gawa namin. Tapos group 1
So,
po kami.
Okay. So, yung group 1
Pero
ang
same lang
tama.
po yung content. Opo.
Okay. Okay. I-delete ko na ha kasi kumakain siya ng space.
Opo, sir.
Okay.
Sorry po.
So, you are now to share your screen, Kagia, or kung sino man mabunot kong group, if you have the copy of Kagia's group of group presentation and narrative, pwede nyo siyang i-present. Okay? So, mamimili na akong sino, ha? I'm so excited. Excited na kayo? Oh my God. Oh. Walang daya, ha? Hindi ko titignan. Okay? So, itatapon ko na to afterwards. Kasi yung matitira na lang, sila na kasama sa bunutan next time. Okay? So, ang magre-report today ay C, Group 3. So, ang magre-report today ay sila, Sir Vera, Erdao, Hina, Reyes, Tabelisma. Okay? Narinig ako? Opo. Okay. So, dito, ito yung first group na nag-report. First. Okay. So, off ko na yung cam ko, ha? Okay. So, Erdao, Sorbera Erdao Hina Reyes Sabalisma. If you have the copy of the writings nila Kagiya, ng group nila Kagiya, please share your screen. Kung wala, Miss Kagiya, please share your screen para i-present yung inyong presentation. So the presentation should be as follow: asthma, COPD, chronic bronchitis, cystic fibrosis, and pneumonia.
And then, okay lang bang present?
Hi, ano yun? Kami ba magpe-present?
No, you are just to share your
Sinend ko
screen.
naman.
Di
Opo,
sige,
sinend
send
ko
nyo
po
lang
sa
sa
GC
kanila.
yung file.
Okay. Erdau's group, you may utilize yung sinend niya sa group.
Eunice, ikaw na lang mag-present, naka-phone ako. Kita ba?
Kita na.
Oo, din. Okay na. Hello. Hello. Yeah. Narinig ba ako? Sige, game. Asthma. Game. Okay. Asthma. Chronic inflammatory disease of the airway that causes airway hyperresponsiveness, mucosal edema, and mucus production. So in 1998, asthma accounted for over 13.9 million outpatient visits to physician offices or hospitals, clinics, and over 2.0 million emergency room visits. So si asthma daw po differs from the other obstructive lung diseases in that is largely reversible, either spontaneously or with treatment. Asthma can occur at any age is the most common chronic disease of childhood. So, si allergy yung strongest predisposing factors ng asthma. Common allergens can be seasonal and perennial. Yung common nagtitrigger sa asthma symptoms and exacerbations in patients include pababa po. Kasi, clinical manifestations. May 3 symptoms daw. Cough, dyspnea, wheezing, tsaka chest pain. So, si asthma, attacks often occur at night or early in the morning, possibly due to the circadian variations that influence airway receptor threshold. An asthma exacerbation may begin abruptly but most frequently pag-iba po. Pababa po. Hello? Finish? There is cough with or without mucus production. There may be general wheezing first, then expiration, and then possibly during expiration as well. Generalized chest tightness, and then dyspnea occurs. The hypoxemia can occur intraventilation perfusion is much and readily responds to supplemental oxygenation. So symptoms of exercise induced asthma include maximal symptoms during exercise, absence of natural symptoms, and sometimes only a description of a choking sensation during exercise. Kaya di ba madalas sa mga hinihika, yung may naasa, yung madalas lang gumalon. Yun. Asthma is categorized according to symptoms and objective measures of airflow obstruction. Sige po. So, assessment diagnostic findings. So, complete family history. Environmental and occupational history is essential. A positive family history of environmental factors including seasonal changes, high pollen counts, mold, climate changes, particularly in cold air, and air pollution are primarily associated with asthma. A variety of occupation-related chemicals and compounds, including ental salt, wood and vegetable dust, medications, industrial chemicals and plastics, biological enzymes, animal and insect dust, sterile secretions. Other possible allergic reactions that may accompany asthma include eczema, rashes, temporary eczema. During acute episodes, sputum and blood tests may disclose eosinophilia. Serum levels of immunoglobulin E may be elevated if allergy is present. So, ABG analysis and pulse oximetry reveal hypoxemia during acute attacks. So, as the condition worsens and the patient becomes more fatigued, and PCO2 may rise. Prevention. Patients with recurrent asthma should undergo tests to identify the substances that precipitate the symptoms. The patient is instructed to avoid the causative agents whenever possible. In 1998, survey a group called Asthma in America found that 11% of physicians were unaware of the national asthma guidelines. Complications. So, includes asthmaticus, respiratory failure, pneumonia, and atelectasis. C. Airway obstruction, particularly during asthmatic episodes, research ng hypoxemia. Fluids are administered because people with asthma are frequently dehydrated from leioporesis and insensible fluid loss with hyperventilation. Sige po. Henrietta. Medications. Long-acting control medication, corticosteroids, are the most potent and effective anti-inflammatory medications currently available. A spacer should be used with inhaled corticosteroids and the patient should rise and rinse the mouth after administration to prevent thrush. Cromolyn sodium and lidocaine are mild to moderate. Are mild to moderate anti-inflammatory agents that used commonly in children. Long-lasting beta-2 adrenergic agonists used with anti-inflammatory medications para makontrol yung asthma symptoms, particularly nag-occur sa night. So, methylxanthines are mild to moderate bronchodilators usually used in Eunice, palitan mo na lang. Basta naman sakto. Yata. Para magpasa. Yan. Wait lang. Sir. Moderate bronchodilators usually used in addition to inhaled corticosteroids. Leukotriene modifiers, inhibitors, or anti-leukotrienes are the new class of medication. Leukotriene are potent constrictors that also dilate blood vessels and doctor permeability. At this time, they may provide an alternative to inhaled corticosteroids for mild persistent asthma or may be added to a regimen of inhaled corticosteroids in more severe asthma to attain further control. Pato na ba? Quick-release medication, anticholinergic, may bring added benefit in severe exacerbations, but they are used more frequently in COPD patients. So, may tinatawag tayong peak flow monitoring. Nag-measure siya kung gaano kataas yung airflow during yung first expiration. The personal best is determined after monitoring peak flows 2 or 3 weeks after receiving optimal asthma therapy. Pag green, 80% to 100% of personal best. Yellow, 60 to 80%. Red, less than 60. Okay, next. Nursing management, assessment, signs and symptoms of dyspnea wheezing mucus production. Diagnosis, ineffective breathing pattern, ineffective airway clearance, health-seeking behaviors, prevention of asthma attack. Planning. Patients will maintain optimal breathing pattern. Patients will verbalize understanding of cause and therapeutic management regimen. Patients will maintain airway patency. Parents will verbalize understanding of triggering agents and prevention measures for asthma attacks. C. Intervention. Assess for use of over-the-counter medications, type use and effects. Instruct the child to refrain from stressful situation and strenuous physical exercise. Assess breath sounds and then adventitious sounds which adds wheezes and stridor. Assess the relationship of inspiration to expiration. Assess for signs of dyspnea. Pairing of nose, use, chest, retractions, and use of accessory muscle. Evaluation, relaxed breathing, normal respiratory rate or pattern, clear breath sounds, so improve oxygen exchange, ability to effectively cough out secretions. Okay. Pathophysiology. So, meron po tayong tinatawag na precipitating factors. So, infection, allergens, exercise, irritants. Ito yung mga nagkakos ng asthma. Right. So, may inflammation sa airway. So, kasi nga may inflammation yung airway, nagna-narrow si bronchioles. So, pag nag-narrow si bronchioles, tataas yung mast cell. So, mag-release siya ng histamine. So, pupunta siya sa smooth muscle, hyperdigital constriction. Okay. So, pag nag-narrow si bronchioles, ayun, pagtataas ay i-increase daw yung mucus production. I-increase din si goblet cells, i-increase din si eosinophils. So, yung best-made membrane, mag-thick. Tapos, pagka nag-increase daw si mast cell, kasi nga nag-release siya ng histamine, tataas daw si neutrophils during inflammation. Next. My question. Sir.
Okay, before we move with the questions, okay. Hindi na natin mababago the reportings that you have submitted, okay? Pero as I see this first first narrative ninyo, okay? 'Di ba, yung pinakita ko sa inyong narrative, okay? Yung pinag-pattern out ninyo, all the signs and symptoms that has been mentioned should appear to your pathophysiology, okay? And also, during the reporting, while you do the reporting, kahit actually hindi na kayo mag-focus sa lahat, mag-focus kayo sa pathophysiology. Dahil in the pathophysiology, dapat na ipapasok nyo na lahat ng discussions ng inyong narrative. Like for example, in here, pag nakita nyo itong precipitating factors, nabanggit na rin naman dapat sa taas, di ba? Yung signs and symptoms, i-place nyo lang kung nasaan dito sa inyong pathophysiology. Yung diagnosis niyo saan cascading effect nung pathophysiology nyo pwedeng magkaroon ng ganung diagnosis. Okay? So for the next reporters and for ganun sana yung flow ng ating reporting. Okay? And yung mga naunang reports, hindi nyo na siya may edit since you have already submitted this. Pero I hoped and I believed na sinundan nyo yung pattern na binigay ko sa inyo. Okay? Anyways, sige. Ang sistema natin, tatapusin lahat ng reporting and then the following meetings for MS, ako naman ang magdi-discuss. Okay? But not the totality of the discussion. I will only put certain glimpse on the certain ideas. Kasi kapag kinain ko pa yun sa lahat ng discussion, chances are mauubusan tayo ng oras. Okay? Sige, kindly, let's proceed with the questions and answer. And let's try to to take a look at how you're going to answer. Be faithful in answering, ha? Huwag niyong isa-search yung sagot. Okay? I-chat in ninyo yung sagot ninyo. Chat in. Okay? So number 1, a patient receive a nebulizer of albuterol. What is the side effect of this medication? A. Bradycardia, tachycardia. B. C. Drowsiness, feeling cold. Servo, A, B, C. D nga. Okay. B, everyone answers B. Okay. I'll choose one. Dalus. Why it's B?
Kasi po nainom po kami sa albuterol expect. Ay, ano po, ganun po. Bata po kasi
Albuterol?
kami. I mean, yung bata po kasi kami, nag-nebulize po kami.
O, nag-nebulize ka din?
Ayun po, may bliss po yung paghinga.
Ang paghinga, pero tachycardia ang sagot mo.
I mean, ano po, ayun po pala, ano po, isa puso. Sorry po.
Bakit kaya?
Kasi po siguro gawa po nung, syempre nag-i-inhale po, bali, may bliss po yung pag-pump para ma-relax po yung ano po, sa may lungs. Kasi di ba pumapasok po yun. Tapos po, syempre, gawa po nung nagsi-circulation po ng blood, nalalagyan po ng oxygen nung may gamot po. Kaya po siguro, parang pinapabilis niya po yung circulation nun. Kaya po siguro mabilis.
Okay. What is albuterol? Pharmacology. Anong klaseng gamot ang albuterol? Hoy, pharmacology. Okay. Albuterol is generally correct. It's a bronchodilator. Specifically, it is a beta-2 adrenergic receptor agonist. Okay? So pag binanggit natin na beta-2, 'di ba? We already have 2 cells, technically 4. Alpha-1, alpha-2, beta-1, beta-2. Ang beta-2 receptors agonist, ang ginagawa niya, ini-smoothen niya yung muscle. Nire-relax niya yung muscle. Kapag nag-relax ang muscle, ang effect nun sa heart, mag-i-increase ng cardiac contractility. Why? Kaya niya ini-increase yung cardiac contractility because remember, nagde-deliver ang blood ng dugo. Tama? Now, kung malaki yung diameter ng iyong blood vessels kasi nga nag-smoothen because of your beta-2 agonist, okay? Kailangan niya mag-pump ng mas malakas para mas malaki yung volume ng blood ang kanyang madi-deliver. Okay? So that's the reason why pag uminom kayo ng albuterol, salbutamol, if it's too much of the requirement, okay? Nag-i-smoothen yung muscle nyo. Lumuluwag ang paghinga nyo kasi nagdadilate ang blood vessels, nagdadilate ang bronchus niyo. Pero in effect, because of the dilatation, mas malakas dapat yung pwersa ng puso para mag-deliver ng dugo, which causes for you to have tachycardia. Okay? So that's basically how albuterol causes tachycardia. Lumaki ang butas, lumaki yung diameter, okay? Pag lumaki ang diameter, mas malaki dapat yung pwersa mo para makapagtulak ka ng mas malaking volume ng blood. Do you understand? Now, number 2. A patient, wait lang, number 1. Why do we intake albuterol for asthma? So we all know for a fact that when you have asthma, you have a narrowing of your bronchus, which is medically termed bronchoconstriction. So for you to avert bronchoconstriction, kailangan buka mo ang iyong bronchus. So to avert that, yung opposite ng bronchoconstriction, we need to do bronchodilation. And one one medication to help for your bronchodilation is your albuterol. However nga, tulad ng sinabi ko sa inyo, yung beta-2 would cause relaxation of your smooth muscles in your bronchus and of course in your blood vessels. But in turn, okay, dahil mas malaki ang butas, you would exert much force for you to eject blood towards that particular diameter. Kaya naman nagkakaroon ng tachycardia. Okay? So, 2. A patient has exercise-induced asthma. Which of the following actions can the patient perform to help prevent an attack during exercise? Select all that apply. A patient has exercise-induced asthma. Which of the following actions can the patient perform to help prevent an attack during exercise? Select all that apply. Avoid warming up before exercise. B. Administer a short-acting beta-agonist before exercise. C. Administer a short-acting beta-agonist after exercise. Or D. Avoid, ano yung D? Hindi ko mabasa eh. Avoid exercises when experiencing a respiratory illness. So, what are the correct answers? Sige, what are the correct answer? Other. Okay. So what's the correct answer? Ang tanong, ano daw, what of the following actions can the patient perform? Ano daw pwedeng gawin to prevent an attack during exercise? Ang sagot ay, let's make an elimination. Avoid warming up before exercise daw. So, technically, it's wrong. Kasi, kapag nag-exercise ka without warming up, you would what? You would strain your body ng biglaan. So, if you have asthma, you need to do it gradually. So, dapat meron kang warming up. Okay? So, basically, it's a wrong choice na kasi avoid. Pero kung walang avoid, tama dapat. Okay? Now, letter B. Administer a short-acting beta-agonist before exercise. Okay? If you already have asthma, you already diagnosed to have asthma, alam mo na kung anong iiwasan mo. Kung ito ay exercise-induced, ibig sabihin, when you do exercise, you would have asthma signs and symptoms. But if you don't, edi wala. So, pwede mong iwasan ng exercise. However, if you're really athletic, if you're into exercise, or you really have to do exercise as per prescription because of your other illness, like for example, chubby ka, mataba ka, you have fats to burn. So, kailangan mo exercise. So, with this, you need to proceed with exercise. But since you know you have asthma, and you know that albuterol or beta-agonist can help you to avert the asthma, then basically, you can have albuterol or salbutamol as medication, preventive medication. Okay? Para hindi ka magka-asthma. Para prior to exhaustion ng exercise, dilated na ang iyong bronchus. So there's no reason for your bronchus to be bronchoconstricted kasi nga, meron ka namang ininom na beta-agonist. So letter B is correct. Okay? Letter C, administer a short-acting beta-agonist after exercise. Kung after exercise mo siya gagawin, okay, chances are na-experience mo na ang asthma. Okay? So, kung na-experience mo na asthma during exercise, then hindi naging effective na ma-prevent mo ang signs and symptoms. Because basically, the question itself refers na mapigilan mo or ma-prevent mo na magkaroon ka ng signs and symptoms ng asthma during exercise because the question itself says or presents na ang iyong asthma is brought about by exercise. So kung ang plano mo ay labanan, kontrahin, di dapat, bago mo ma-experience ang signs and symptoms, meron ka ng medication or treatment na ginawa. Pero kung ginawa mo siya after, then therefore, hindi na-meet yung iyong goal na ma-prevent ang signs and symptoms. So letter C is wrong. Okay? Letter D, avoid exercising when experiencing a respiratory illness. Avoid exercising daw when experiencing a respiratory illness. Is this correct? The answer is correct. Avoid exercising when experiencing a respiratory illness. Ang sabi, avoid exercising when experiencing a respiratory illness. Why? Because you all know for a fact that when you have respiratory illness, okay, experiencing respiratory illness, pag nakita nyo experiencing, ibig sabihin, you have respiratory illness prior hand to. Pero pag sinabing experiencing, ibig sabihin, you are experiencing signs and symptoms. So it's not necessarily ibig sabihin na you are not allowed to do exercise when you have respiratory illness. But what does letter D say is that you avoid exercising when you have signs and symptoms of your respiratory illness. So ganito sila mag-construct ng choices. Now, sir, bakit tama ang letter D? Avoid exercising when experiencing a respiratory illness. When you already have a respiratory signs and symptoms, okay, you do avoid exercise. Why? Because we all know for a fact, when you do exercise, you need a lot of oxygen. Your body would be requiring a lot of oxygen for you to sustain that exercise. And meron ka ng signs and symptoms. Diba? So kung magkakaroon ka ng signs and symptoms, at yung signs and symptoms, so for example, is DOB na nga, okay, difficulty of breathing, dyspnea, and then mag-exercise ka pa, the oxygen requirement will be further depleted. So mas hindi makakatulong sa katawan mo. Yung exercise mo would lead for you to have exhausted body kasi nga wala kang enough oxygen because you have respiratory illness. So therefore, avoiding doing exercise when you have signs and symptoms of respiratory illness is a right thing to do. So therefore, for number 2, the correct answers are B and D, boy and dog. Understood? Number 3. You are educating a patient how to use peak flow. Okay. Wait lang before I move. Kung makikita nyo, when you try to make an answer, lalo sa board exam, you really have to tanungin ang sarili nyo in every options. Okay? In every choices you have. Okay? Para makita mo na, o nga, pag ito ginawa niya, possible ito. Pag ganito, possible ito. Okay? Because the question itself is tricky. The choices itself is more tricky. Merong mga tanong na mahirap na pero mas mahirap ang choices kasi parang lahat ng choices ay tama. May mga pagkakataon na lahat ng choices ay tama but you only choose the best answer. Pagdating naman sa select all that apply, pag-isipan nyo kasi minsan maluloko kayo ng avoid. Pag nabasa nyo yung mismong choice, tama naman yung ginagawa, pero nakalimutan nyo may nakalagay na avoid. So, ibig sabihin, tama yung dapat na ginagawa, pero dahil nilagyan na avoid, binabanggit niya na hindi dapat gawin yung tamang ginagawa. So, isa yung sa kailangan nyo balikan. And also, sa select all that applies, kung ano yung nakita nyo feeling nyo tama, huwag nyo nang baguhin. Okay? So, kasi pag nabago nyo pa, lalo kayo malilito. So, number 3, you are educating a patient how to use a peak flow meter to help monitor the status of their asthma. Which statement by the patient demonstrates they understand how to use the device? A. The device will help keep my lungs strong so I don't have another asthma attack. B. I will inhale as hard as I can while using the device. C. I will use this device at the same time, either in the morning or before bedtime, and compare the readings with my personal best reading. Letter D. I will notify the doctor if my peak flow rating is 90% or more than my personal best peak flow. The correct answer is? The correct answer is? Merong B, merong B, merong C, reporter. Anong correct answers? Yung gumawa na question na to, what is the correct answer? Kagiya? What's the correct answer?
Si Bides po.
Ha?
Bides.
Okay. The correct answer, kung nakinig kayo kanina, okay? Kung nakinig kayo doon sa reporting kanina, nabasa niyo yung personal best, di ba? Nabasa ba? Yung personal best? Okay. So kung nabasa yung personal best, that's the correct answer. Okay? Why? Eliminate natin. A, this device will help keep my lungs strong so I don't have another asthma attack. That particular statement is true and false. First, it's true because it will help your lungs to be strong. Okay? Kasi nga, bubuga ka, hihinga ka, and malalaman natin yung capacity ng yung lungs sa pagbuga at pag-inhale. But, it will never end or ensure you na hindi ka na ulit magkakaroon ng asthma attack. So, letter A, it's wrong. Letter B, I will inhale as hard as I can while using the device. Okay. Is this correct? False. Why? Kasi nga, ang mini-measure ng iyong peak flow meter is your capacity to inhale and exhale. Okay? So kapag asthma kasi, yung asthma, remember, when you have asthma, nagkakaroon ng occlusion, nagkakaroon ng constriction ang iyong bronchus. So therefore, kapag nagkakaroon ng constriction, ang constriction mo, bronchus. Pero yung trachea mo, upwards, they are open. They are not bronchoconstrict. So yung passage ng air, they are capable to pass through in. Okay? However, yung hangin magmula sa katawan palabas, natatrap. Kasi nga, constricted. So therefore, it is not the inhale that is being measured. More so, it's your exhale capacity. Now, if you are to inhale ng mamala your peak flow, okay, it will not measure your exhale capacity. Kasi nag-exert ka ng sobrang effort. Ang kailangan nating makita nga dyan, yung normal effort lang. Kasi kapag nag-create ka ng higher effort, then that would say you have asthma. But, kaya nga ang kailangan natin i-measure is yung normal effort lang para makita natin kung doon sa normal effort, hirap ka ba o hindi. Kung sa normal effort ay hirap ka na, then therefore, likely you have asthma. Okay? Nag-gets ako doon sa letter B. Medyo nagulahan din ako sa paliwanag ko, pero nag-gets ko naman yung paliwanag ko. Nag-gets nyo ba siya? Okay. Walang kontra. Letter D. I will notify the doctor if my peak flow rating is 90 or more than personal best peak flow. Kung binalikan nyo at nakinig kayo kanina sa reporting, there are 3 colors pagdating sa peak flow monitoring. Okay? So first, you have the green, which is 80 to 100% of personal best. Kapag 80 to 100% of personal best, wala kang kailangan gawin. Relax. So therefore, letter D makes your answer wrong. Kasi bakit ka tatawag sa doktor kung ang flow rating mo ay 90%? Eh ang 90% nga sabi natin kanina ay Okay, normal. Kapag yellow naman, 60 to 80%, this would mean na kailangan mong magkaroon ng evaluation doon sa medication mo. Kasi baka meron kailangan i-adjust. Pag kulay red, less than 60%, that's the time that you really have to notify your doctor. Because this means you have an asthma attack and the medication and treatment is not working for you. Okay? So the correct answer is letter C. I will use this device at the same time, either in the morning or before bedtime, and compare the readings with my personal best reading. Now, sir, why it's correct? It's correct because gagamitin mo siya at the same time, which is the proper. Why same time? Kasi para makita natin kung meron bang activity na nakakahinder or activity na nakakapag-promote ng iyong best breathing. Okay? So, like for example, kung morning, tapos morning ka, tapos ikukumpara mo sa gabi, baka meron mga factors that would result sa alteration ng reading. So, para maiwasan natin na magkaroon ng alteration based from time, then same time natin siya dapat ginagamit. So, kung 12 p.m. 8 a.m. ng morning kahapon, tomorrow 8 a.m. din ng morning. Okay? At i-compare mo siya sa personal best reading mo. Kahapon ng 8 a.m., 90 ako. Ngayon, ng 8 a.m., 80 ako. So, makikita mo, bumaba ang rating ko. So, that's the time na meron kang kailangan gawing adjustment sa iyong modality ng treatment or ng iyong medication. Okay? Number 4. Three questions lang. Okay, so COPD, chronic obstructive pulmonary disease. Erdaus group, sino magre-report?
Si Lori po.
Lori Lee. Tabilisma?
Opo, sir.
Okay. Go ahead, Tabilisma. Lori Lee, ready?
Sir, nawalan po yata ng net. Kasi putol-putol daw po yung connection nila. Next na lang po.
Okay, next please.
Ang tapang ni Eunice mag-next.
Wala si Lorelie, sayang oras.
Okay lang, bet. So, guys, ako muna. So, yung topic is acute bronchitis. So, ayan yung picture ng acute bronchitis. So, tracheobronchitis pala. Sorry. So, tracheobronchitis is usually acute, which means the symptoms can be treated to make you more comfortable, but infection itself usually passes naturally. So next, Eunice, please next yung sa definition. So what is it? An acute inflammation of the mucous membranes of the trachea and the bronchial tree often follows infection of the upper respiratory tract. Next po. So clinical manifestations, severe tracheobronchitis, blood-streak secretions may be expectorated as a result of irritation of the mucosa of the airways. So next. So medical management, so antibiotic treatment. So, antihistamine, hindi daw, sabi dun sa na-search, hindi daw pwede si antihistamine kasi, yung cause niya is, di na-dry up niya tawag dun, yung antihistamine, dinadry up niya yung secretion, which is nagkakos, pwedeng mag-cause ng severe cough. So fluid intake, increased fluid intake kasi fluids, di ba, water, kapag in-increase natin yung fluid intake natin, may tendency na mag-thin yung mucus. So, next po. Next po is medical management, suctioning and bronchoscopy. So, doon po, for sputum po, siya yung nagde-detect kung ano ba yung cause ng difficulty ng breathing natin. And then, endotracheal intubation. So, alam niyo naman kung ginagamit to. Di ba alam niyo naman guys kung para saan si ET tube. And then, tapos cool vapor therapy or steam inhalation. So, ginagamit to para mag-loose yung mucus dun sa nasal passages natin. And then, moist heat to the chest. So, sabi doon, nire-relief daw neto yung pain. So, next po. Eunice, next na. So, nursing management is usually treated in the home setting. So, sabi sa report ni Sab, encourage bronchial hygiene such as increased fluid intake and directed coughing to remove secretion. So, encourage and assist the patient to sit up frequently to cough effectively and to prevent retention of mucopurulent sputum. And then, next, if the patient is taking antibiotic for an underlying infection, so the need to complete the full course of antibiotic prescribed is emphasized. Okay, next na please. So, caution the patient against over-excretion. Yun, advise patient for rest. So, chronic bronchitis. So, ayan yung, guys, yung picture, yung pinagkaiba ng healthy, tsaka sa, dun yung, kapag may mucus na dun sa bronchus natin. So, what is, so, a disease of the airway is a defined of the presence of cough and sputum production for at least 3 months in each of 2 consecutive years. Pag chronic po yun na. Next po. So, sa pathophysiology. So, risk factors natin. So, meron tayong smoking, environmental pollutants. So, dahil dun sa mga risk factors na yon, nagkakos na ng inflammation. So, dahil meron tayong inflammation, so mag-i-increase ngayon si goblet cells. Tapos, increase din yung mucus secreting glands natin. So, ano bang meron kay goblet cell? Si goblet cell, siya yung nagsisikit ng mucin. Tapos, iba siya yung nag-create ng protective mucus layer. Si mucus secreting glands, siya yung nagpo-produce din siya ng mucin. Tapos, mucin that absorbs water to form a sticky secretion. So, tinatawag na natin yun na mucus. And then, dahil nga increase Meron increase sa goblet cells, meron din increase kay mucus secreting gland, mucus secreting glands. Ngayon, magkakaroon ng mucus hypersecretion. Dahil nagkaroon ka ng mucus hypersecretion, sobra-sobra na yung ano dun sa loob mo. Tapos magkakaroon ngayon ng plugging. Dahil nagkaroon ka ng mucus plugging, syempre, yung bronchial walls mo, syempre pag, di ba, pag nagkaroon na ng mucus plug, syempre mag-thickened na yon. Diyan, decrease ciliary functions. Kapag nag-decrease yung ciliary function natin, yung air passages, syempre, yung limited din yung air passages natin. And magkakaroon na ng irritation, increased irritation na doon. Tapos ayan, dahil si cilia mo, dahil si cilia mo, hindi na siya makapag-function ng maayos. Nada-damage na ngayon yung alveoli mo. And then, dahil, di ba, dahil sumikip na nga yung bronchioles mo, syempre, magkakaroon na ng airway obstruction. So, hindi ka na masyadong makakahinga, which cause difficulty of breathing. And then, dun sa alveoli, magkakaroon na ng altered function. And then, yan. Okay na.
Yung mga pathophysiology nyo, kinaka-face nyo lang, ha?
Bakit yung pato?
Dapat yung pathophysiology, when you have read references that says your signs and symptoms, okay? Ang hahanapan nyo na gagawa ng pathophysiology are the signs and symptoms. Okay? Kasi kung titignan nyo yung pathophysiology na pinapresent nyo ngayon sa reporting, okay? Dun sa ginawa ninyong presentation, okay? It doesn't show completely how the cascade of the signs and symptoms happen. Okay? So dapat makita nyo yung cascade para pag nakita nyo yung cascade ng signs and symptoms, you would know saan papasok ang intervention ni nurse. Okay? If not, doon nyo makikita saan nag-work yung medication or certain treatment na in-order ni doc. Okay? On that aspect, you would better know, okay, kung ano yung i-expect ninyo sa pasyente. Kapag ganito na ang signs and symptoms sa pasyente, bakit nagbigay si doc ng gantong gamot na to? Because you know kung saan nagmula ang signs and symptoms na yun. Or, for example, when a certain medication has been given or a certain treatment has been facilitated, alam nyo kung bakit ganito yung naging reactions or response ng pasyente sa particular care modality. So, dapat ganun nyo siya nakikita. Okay? It will make you a better nurse kapag nakikita nyo kung paano nangyayari, paano nagsimula, paano matatapos ang isang bagay o isang signs or symptoms ng inyong pasyente. So, hindi dapat kayo nalimita lang sa nakita nyo kung increased goblet cells, mucus hypersecretion. Dapat nakita nyo what causes the increase of goblet cells. Ano yung cellular level? Kaya binanggit ko sa inyo, iba, gusto ko makita yung cellular tissue level cascade hanggang sa signs and symptoms. Kasi kapag nai-flat yung maayos sa pathophysiology nyo, mas makikita sana natin yung mga binanggit ninyong nursing management na diagnosis, kung saan natin ipapasok doon sa particular na pathophysiology. It would be better sana kasi kung magkakaroon kayo ng case presentation, nagawa nyo na. Hindi nyo na kailangan paghirapan pa kasi nagawa nyo na sa MS ninyo. Hihiramin nyo na lang. Anyways, good start. Sige. Questions? Asan yung questions?
Sir, wala po atang question after
Nagkamali po sila ng principal po yun yung CPDP. Nagkamali ata yun ng principal. Hindi yan yung different na PP. Message.
Sorry, yan kasi yung nasa akin. Hindi ko alam.
Sige.
Pero okay lang kung
Kasi
ano,
kompleto na rin yung
kayo na lang mag-present.
kompleto kasi.
Okay. Huwag na kayo magtalo. If there's no question, it's okay. Okay,
Hindi,
now,
kaya
I would ask...
mag-report ka, so wag ganun.
Now, I would ask a question. Okay? Binanggit kanina, antihistamine is as much as possible prohibited. Okay? Or generally prohibited talaga. Ano ang sagot doon? Sabi ni Ms. Decano, Laksamana, nakaka-dry po ng secretions. Basically, it's correct. Okay? So generally, yung antihistamine, ipinagbabawal natin sa acute bronchitis or tracheobronchitis. The reason why? It is because bronchitis, lahat ng itis inflammation. Okay? So since ang affectation natin ay lung or parts of the lung, it would cause some sort of phlegm. And with the antihistamine, okay, kapag binigay, magda-dry up yung phlegm na yun. Pag nag-dry up yung phlegm na yun, it would aggravate doon sa difficulty of breathing kasi mag-aggravate yun kasi yung na-dry na mucus, it would be blockage doon sa inyong airway. Kaya bawal ang antihistamine. However, if your acute bronchitis or your bronchitis is not caused by bacterial origin, it's viral in origin, or it's fungus in origin, it would not result to phlegm. So if it not would result to phlegm production, would antihistamine be allowed to bronchitis caused by virus or fungus? Answer. Answer. Kapag viral bronchitis or fungal bronchitis, pwede ba ang antihistamine? The answer is yes and no. Okay? If it's only beginning, okay, parang coronavirus, if it's beginning, non-productive cough kasi wala ka nga talagang phlegm pang nabubuo. Okay? Because it only invades the cell. Okay? When it invade yung cell, ina-alter niya yung totoong function ng cell. So, with the bacterial bronchitis, ang totoong function ng inyong mga goblet cells is to produce mucus. Diba? Gawa ng protective lining. So, kaya nagkakaroon ng plema. But with the viral, since ina-alter niya yung normal function ng inyong goblet cells, it will not produce mucin. So, it will not cause for you to have mucus or phlegm. So, wala namang kailangan, walang madadry up doon ng antihistamine. So, antihistamine would be beneficial. However, in the long run, kapag matagal na, nagpo-produce na siya kasi nagkakaroon tayo ng rebound effect. Remember, kapag continuous na mataas ang DP mo, ang long run, kasunod na yan, rebound effect, bababa na siya. Because there's no way na pwede pa siyang tumaas pa kapag narating niya na yung peak. So same with the mucin, kapag narating niya na yung peak na hindi na siya pinagpo-produce ng mucin, yung goblet cell, narating na ng goblet cell yung kanyang peak, na hindi na siya magpo-produce ng mucin, magre-rebound na siya. Wala na siyang choice kundi mag-release ng mucin. Because, di ba, there's no way up but down kung ikaw ay pataas, and there's no way down but up pag ikaw ay pababa. Okay? Acute and chronic. What's the difference between acute and chronic? Answer.
Kapag po acute, sir, parang maaalis, halimbawa naka-experience ka ng symptoms is maaalis siya for several days or kaya week. Pero kapag chronic, naglalas for 3 months or more.
Okay, very good. Acute and chronic depends on the timetable. Okay? Kapag maikli lang, sudden ang onset, nare-relieve within 2 weeks in time interval, then this is acute. However, if it's more than 2 weeks, and usually pwede siyang maging lifetime, it's chronic. Okay? Not all acute would lead to chronic, okay? But yung chronic usually nagsisimula siya as acute. Okay? Pero yung chronic hindi siya pwede mag-downgrade to acute. Once it's chronic, it's chronic. Okay? Do you have questions? Next reporter.
Si Laurely po. So, yun po ang akin ay COPD or chronic obstructive pulmonary disease. Next. So, definition, chronic obstructive pulmonary disorder is a preventable or treatable slowly, progressively respiratory disease of airflow, obstruction and involving the airways, pulmonary parenchyma or both. The parenchyma includes any form of lung tissue including bronchioles, bronchi, blood vessels, intertdiffusion and alveoli. The airflow limitation or obstruction in COPD is not fully reversible. Most patients with COPD present with overlapping signs and symptoms of emphysema and chronic bronchitis, which are two distinct disease processes. Next. Ang risk factors niya ay yung predisposing, nagsisimula siya sa increase of age, alpha-1, and anti-enterlipsin deficiency. Precipitating niya is cause of cigarette smoking, perpetuating cause of environmental exposure to tobacco smoke, air pollution, and chemicals. Then, clinical manifestation niya first is the 3 primary symptoms of COPD is cough, subtube production, and dyspnea. Yung chronic cough and subtube production often precede the development of airflow limitation by many years. Dyspnea may be severe and often interferes with the patient activities with loss is common because the dyspnea interferes with eating and the work of breathing is energy and depleting. Then, the patient with COPD is at risk for respiratory insufficiency and respiratory infections, which in turn increase the risk for acute and chronic respiratory failure. Next. It is Yung diagnostic niya po ay spirometry, yung chest x-ray, CT scan, ABG analysis, and laboratory test. Sa medication po niya ay beta-2 agonist, corticosteroids, cromulin sodium, and anticholinergics. Yung treatment po niya is oxygen therapy, nebulizer, metered dose inhaler of MDI. Next po. Tapos
ba't
yung
nawala?
pain management po niya, yung assessment po, sign and symptoms, yung health history, physical assessment, then diagnosis po ay ineffective airway clearance, impaired gas exchange, ineffective breathing pattern, then imbalanced nutrition less than body requirements, then risk for infection, deficient knowledge and activity intolerance. Next po. Tapos po sa planning niya po, may 5 pong nakaano sa planning, yung improve airway patency, restore breathing pattern, obtain optimal gas exchange, then increase activity tolerance, learn more, nawala. Learn more. Learn more about the disease and how it is acquired. Then, sa intervention niya po is first, position head midline with flexion on appropriate for age or condition. Then, keep environmental pollution to minimum such as dust, smoke, and feather pillows according to the individual situation. Then third, encourage abdominal or pursue lip breathing exercise. Then demonstrate effective cupping and deep breathing technique. Teach and assist the patient with active ROM exercise. Then review the harmful effects of smoking and advise cessation by the patient. Then, administer medication as needed. Next po. Tapos, sa evaluation niya po is first, patient maintains an effective breathing pattern as evidenced by relaxed breathing at normal rate and depth and absence of dyspnea. Then, second, report or demonstrate a measurable increase in tolerance to activity with absence of dyspnea and excessive fatigue and vital signs within patient acceptable range. Then, third, maintain airway patency with breath sound clear or clearing. Then, fourth, patient will start attending smoking cessation programs. Next po. Doon po sa pathophysiology niya po ay lang po. Yeah, nagkakos po siya ng Kakasa ng inhaling of irritants for cigarette smoke or air pollution. Thus, nagano po siya ng production of